We all need air to breathe, and yet the quality of air differs greatly across the country and around the world. In response to growing air pollution and increased health risks, the Clean Air Act of 1970 was passed in the United States. In the 50-plus years since, updates continue to improve air quality. However, there are still distinct regions of the country that continue to have significantly poor air quality, and these regions are usually associated with higher populations of people of color. I'm John Hoffman, and in this week's Ethical Dilemma in Science, we're going to take a look at how do we improve air quality in polluted, redlined neighborhoods. As with all of these ethical dilemmas in science, this one is based in part on a recent news account. In this case, an article in Wired magazine from 2022 summarizing recent findings that show that race is a good predictor of the quality of the air that you breathe, with pollution concentrations tied to racial community segregation. There have been a number of scientific studies and news reports on air pollution and the effect on health. It's been shown that air pollution is associated with about 100,000 annual premature deaths in the United States as of 2017. And in addition to these deaths, it exacerbates or worsens a variety of adverse health conditions, including cardiovascular disease, respiratory disease, cancers, adverse birth outcomes, and cognitive decline. When we take a look at individuals that are exposed to different types of air pollution, what we can see is that people of color, in general, are going to be more exposed to hazardous air quality than individuals of Caucasian populations, with a whole variety of sources of this air pollution, including construction, power plants, industrial, cars and trucks in terms of highways, and a little bit as well as agriculture. Recently, investigators have looked at air quality at a neighborhood level. In particular, they've looked at air quality in relationship to historic redlining. Now, redlining was a policy put in place by the Homeowners Loan Corporation in the early 1900s, and on the slide here we've got a map of Philadelphia from 1937, and they basically went through and looked at neighborhoods and determined which neighborhoods would be eligible for federally backed loans and favorable mortgage conditions. And so certain neighborhoods were given a grade A quality and given the best conditions, where other regions, like this redlined region here, grade D, these were viewed as being poor quality investments with a basically poor conditions given with mortgage, or they wouldn't issue these federally backed mortgages. Now, in general, the locations, the neighborhoods that received these poor grades were generally given to Black and immigrant communities or associated with already environmental pollution sources. Now, in comparison to the 1937 redline map of Philadelphia, we're including a 2012 zoning map. And it's not exactly the same, not a direct comparison, because of the urban expansion of the Philadelphia as well as other metropolitan areas. But what you can see is that in general, commercial and industrial regions are located highly in those areas that were graded poorly in the redlining map, receiving either a grade D or a grade C, definitely declining in the neighborhood. Again, indicating that in these regions, the institutions, the government may have implemented policies that would place polluters or polluting companies in these locations where they were also going to have these high concentrations of minority populations. Now, extending this information on historic redlining to current population dynamics, comparing, again, Philadelphia from 1937, the redlining map, versus the concentration of racial segregation within Philadelphia in 2018, again, we can see that those historic regions that were redlined continue to be locations with high populations of people of color. And this is important because it indicates that there hasn't been a lot of change, even though the practice of redlining was outlawed in the 1960s. Now, this is important because other studies have shown that there are inequities based on location on life expectancy. And in some studies, they can show a difference of 15 years of life expectancy between poor, predominantly black neighborhoods and wealthier, predominantly white neighborhoods. In a study published in 2022, Environmental Science and Technology Letters, Lane and Associates took a look at this redlining pattern, this practice of assessing neighborhoods for mortgage quality and federal loans in 202 U.S. cities, which comprise about 45 million people. And what they were able to demonstrate in this graph, taking a look at nitric oxide, an example of air pollution, is that those communities that were in the 1930s green-lined areas, so basically viewed as quality investments for mortgage and federally backed loans, they have a much lower air pollution index in 2010 compared with the regions that were redlined that have a much higher level of air pollution in those neighborhoods, even 80 years after the initial redlining maps were created. Now, in this same study, they looked at this relationship between air pollution along the y-axis, along the up and down portion of it right here, looking at it in relationship to the loan corporation maps here, and then compared that with current race and ethnicity. And we can see a good correlation going on between those populations or neighborhoods with non-minority populations having lower air pollution than those populations that have people of color living within them. And this is occurring kind of nationwide, as well as looking at it specifically within urban locations. Again, indicating that what we're looking at is this lingering presence of poor air quality associated with neighborhoods that were linked to minority populations over almost 90 years ago at this point. They expanded out and looked at race in relationship to the different grades, and so these are the mortgage grades A, B, C, and D, the D being the redlined issues. And what we can see is, again, the air quality increases as we look at those regions that were historically redlined. So all races experience higher exposure to air pollutants by their HOLC grade. This is important because we have this situation where those individuals that their parents, their grandparents may have lived in one of these red line districts, it became much more difficult for them to buy a home, to build wealth through home ownership. And because of that, they have less capacity to be able to move out of these neighborhoods. Now, discussions of critical race theory are highly controversial in the news right now. But in its essence, critical race theory is a kind of way of looking at problems and trying to determine whether or not there is a racial basis of oppression associated with it. Now, in this case, the redlining was established to determine whether or not there was a quality investment possibility in these minority neighborhoods, but that decision 90 years ago continues to have an impact on the quality of life of those individuals living in these neighborhoods now. And they're basically trapped in these neighborhoods because they haven't been able to build the wealth associated with historic home ownership. And so become difficult to address these situations if we're not able to look at the effect that these past policies have on current conditions. And this is especially concerning in that 28 states have introduced over 70 bills banning critical race theory and the discussion of these issues in public colleges and universities since 2021, and 7 states, including Florida, illustrated here on the slide, have passed laws to prevent that from being discussed and taught within colleges and universities. So this leads into our ethical dilemma and science for this week. How do we improve air quality in polluted redline neighborhoods? Is the connection between historical redlined regions, higher minority populations, and poorer air quality evidence of historic and structural racism? How do we address the disparities in air quality in these vulnerable communities? And then finally, recognizing that if something needs to be done, somebody has to do it. Who should be held accountable for improving air quality in these areas? Please see the description below. I'm going to tag a couple articles as recommended for getting some good background information on this topic, as well as the references that I used in putting together this video. So please see that for additional information and references. Thank you and have a great week.